In this study, we have investigated how patient-reported outcomes, that is, the patient's perception of, for example, pain and fatigue and functional level, is impacted by treatment with TNF inhibitors, which are a class of biological drugs. And we have looked into patients who are treated for axial spondyloarthritis. We set up this study because traditionally all of our treatments, our biological treatments, are investigated in randomized controlled trials where there are very strict inclusion and exclusion criteria, and where we typically focus on more objective measures like joint counts and inflammatory markers in blood tests. But we don't know much about how patients in the real world are doing when they're treated with these drugs, and we don't know much about the patient's experience with the drug and how their symptoms like pain and fatigue and functional disability changes during treatment. We used a collaboration of registries that we have established, which is called EuroSPA. It consists of 16 registries in Europe that all register data on patients with axial spondyloarthritis who are treated in everyday clinical practice. And these data were gathered from the 16 registries here centrally in Copenhagen, where we are located. And we then did analysis on patients' scores on pain and fatigue. Typically, those scores are measured on a 0 to 100 scale, where you answer how much pain are you in today, and you can then indicate that on this scale. And we then looked at how these scores changed over time. And specifically, we looked at how many patients are doing very well, have very low scores after 6 months. Well, we found out that generally there is a good effect of TNF inhibitor treatment on both pain and fatigue and level of function, because overall these scores diminished substantially over time. They were reduced with about 60% on the group level, meaning if we sort of look at all patients. We also saw that around 1/3 of patients actually got very low scores after 6 months, where we call that they managed remission, so that there is no active symptoms. And you can say that's a good thing, but it also shows that around 70% or 2/3 did not get into that stage. I think there are important results to take with you when you, as a physician, sit in a consultation room with a patient and consider whether this treatment is a good treatment for your patients, and something that we can communicate and say that overall you can expect that not just your inflammatory markers in the blood, but also your symptoms will get better. I think that's reassuring and nice to know. And then on a sort of more scientific level, I think we would like to move on and look into, are there certain patients where we can predict that they will behave better than other patients, and maybe use that in the long run to choose the right treatment for the right patient.